My name is Haley. I am a nurse practitioner student from the University of Memphis, and I'm going to be doing your full head to toe assessment today. I'm going to be assessing your skin overall throughout the assessment for color, temperature, moisture, texture, edema, any the turgor, bruises, scars, lesions, and nevi. And I'm going to start by assessing your face for all of that, and then I'm going to be looking at your head for size, symmetry, and making sure it's a midline position, which it is, normal cephalic head shape. I'm going to be looking at your scalp for any hair distribution, hair texture, hair color. I'm going to be looking for any lesions, any masses, any depressions, any infestations, and do you have any tenderness?
No.
Okay, nothing was noted on there. Next, I'm going to be palpating your temporal arteries. You have any tenderness there?
No.
Okay, pulses are felt on both sides. And next, I'm going to go ahead and palpate your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental. All right. Anterior cervical, posterior cervical, supraclavicular. Any tenderness noted with any of those?
No.
Okay, no enlargement noted. And next I'm going to be going ahead and doing your assessment for cranial nerve 5. So I'm going to get you to clench your jaw down. Okay, strength is felt on both sides of the masseter muscle. And I'm going to test for sensation now, cranial nerve 5. Go ahead and close your eyes for me. Tell me where this is felt.
Left cheek, forehead, right cheek, chin, nose.
All right, cranial nerve 5 is intact. I'm going to be testing for cranial nerve 7. I'm going to get you to smile for me. I'm going to get you to frown, raise your eyebrows, puff out your cheeks, pucker your lips for me. All right, very good. Cranial nerve 7 is intact. Next, I am going to go ahead and do your ear assessment. So first I'm going to be looking at shape and position on both sides. Very good. Both in normal position, normal shape. I'm going to be looking at your tympanic membrane. Okay, pearly gray, no discharge noted, no redness noted. Pearly gray, no discharge and no redness noted. I'm going to be palpating your pinna and your tragus for any tenderness or masses. You got any tenderness there?
No.
Okay, and I'm going to be assessing cranial nerve 8 now. So first I'm going to go ahead and do the Weber test for lateralization. You heard on both sides?
I heard that equally.
Okay. And next I'm going to be doing it for the Rene test for air conduction and bone conduction. Tell me when you stop hearing the sound.
No.
Tell me when you stop hearing the sound.
No.
Okay. Tell me when you stop hearing the sound.
No.
Tell me when you stop hearing the sound.
No.
Okay, air conduction is greater than bone conduction on both sides. And next I'm going to be doing the whisper test, so if you could occlude this ear for me over here. You repeat after me.
1, 2, 3.
Okay, other side.
4, 5, 6.
Okay, very good. That is cranial nerve 8 that I was assessing, and everything is intact for that. Next I'm going to go ahead and assess your eyes. If you could remove your glasses for me, please. Okay, looking at your eyebrows, your eyelashes, your palpable fissures, everything looks good. I'm going to be looking at your sclera and your conjunctiva for color, lesions, and discharge. No discharge noted, color is pink, and everything is moist. I'm going to be assessing cranial nerve 2 now. First test for that is visual acuity. Go ahead and read the smallest line you see for me here.
LTFPH.
Okay, cover up one eye for me. Smallest line you see.
LTFPH.
Okay, other eye.
LTFPH.
Very good. Visual acuity is 20 out of 20. You can go ahead and put your glasses back on. I'm going to be assessing your peripheral vision now. If you could look straight at me, I'm going to have you tell me when you see my fingers.
No.
Okay.
No.
Okay, cranial nerve 2 is intact. Now I'm going to go ahead and assess cranial nerve 3 for accommodation and convergence. Look at my finger for me. Look at the wall behind me. Back at my finger. Okay, very good. Pupils constricted with focus, which is normal. Next, I'm going to be checking your eyes for your for your response to light. Okay, constriction noted on both sides, both direct and consensual. Very good. Pupils are equal and responsive to light and accommodation. And next, I am going to be checking for your extraocular movements, cranial nerves 3, 4, and 6. Follow my fingers for me. Okay, no nystagmus noted. Next, I am going to be going ahead and assessing the nose, making sure it's midline and straight. I am going to be assessing your nasal patency. Go ahead and include one nostril for me. Breathe in and out for me. Other side. Okay, that's assessing your patency. You're palpating your frontal, maxillary sinuses. Do you have any tenderness there?
No.
No enlargement noted. Next, I'm going to go ahead and look at your mouth. I'm going to be looking at lips, pink, looking at your mucous membranes. I'm going to be looking at your tongue, your teeth, your buccal mucosa. Lift your tongue for me. Looking underneath your tongue, I'm looking at your palate. I'm looking at your salivary ducts. I'm looking at, go ahead and stick out your tongue for me. Looking at your posterior pharynx. I'm going to be looking at your tonsils. I'm going to get you to say ah for me. Okay, tonsils are a grade 1. Do you have any tenderness there?
No.
Okay, good. And whenever he said ah, that was assessing cranial nerve 9 and 10, and everything was symmetrical with phonation. Next, I'm going to get you to stick out your tongue for me. Okay, it's symmetrical. Cranial nerve 12 is intact. And then I'm going to go ahead and assess your neck. So I'm going to be looking at your neck for any color, temperature, moisture, texture, edema, any turgor, bruises, scars, lesions, or nevi, none noted. And I am going to be palpating your trachea, midline and straight. I am going to be palpating your thyroid gland, no enlargement noted. Next, I'm going to go ahead and palpate for your carotid arteries. Okay, pulsations felt equally on both sides. Next, I'm going to be auscultating your carotid arteries for any bruise. Okay, no bruise noted. Then I'm going to be feeling for your cranial nerve 11. Go ahead and press your shoulders up for me. Okay, strength is symmetrical on both sides. Cranial nerve 11 is intact. And then I am going to be assessing your posterior back now, posterior chest. I'm going to first be looking for any symmetry, any deformities, none noted. Next, I am going to be feeling for chest expansion. Go ahead and breathe in for me. Okay, breathe out. Symmetrical. And I'm going to be looking for any use of accessory muscles. I'm looking for any retractions, any tripod positioning. I'm going to be looking for any cyanosis, which none is seen. Be looking for any tachypnea, none is seen. And I'm going to be going ahead and assessing for tactile fremitus. So repeat 99 for me.
99, 99, 99.
Okay, very good. I'm going to be percussing your back, okay? Starting above the scapula. Making sure I get the right middle lobe. Okay, resonance heard throughout. And next I'm going to go ahead and be auscultating his lungs. Deep breaths for me. Good. Okay, breath sounds are clear and equal in all areas. I'm going to then be assessing for egophony. So I'm going to get you to say E for me.
E. I'm
And assess for bronchophony now. Go ahead and say 99 for me.
99, 99, 99, 99.
I'm going to check for whisper pectoliloquy. So go ahead and say 1, 2, 3 for me.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, and all of those are negative. I'm going to be looking overall at your chest on both sides for colors, temperature, moisture, texture, edema, any scars, the turgor, any bruising, lesions, or nevi on there. None noted. I am going to go ahead and have you say 99 for me.
99.
Okay, tactile fremitus is equal on both sides. I'm going to check for your chest expansion. Okay. Very good. Now I'm going to auscultate your lungs on this side. Okay, everything looks good. I'm going to go ahead and assess your heart now. So I'm going to be listening to your heart with the bell first over the aortic area, second intercostal space on the right side, pulmonic area, second intercostal space on the left side, Erb's point, third intercostal space on the left side, tricuspid, fourth intercostal space on the left side, mitral, fifth intercostal space on the left side, and midclavicular. This is also the point of maximal impulse that I'll palpate here. And I would listen for 1 full minute. Won't do that for time constraints, but I'd be auscultating for rate and rhythm for 1 full minute. And next, I am going to assess with the diaphragm, aortic, pulmonic, Erb's, tricuspid, and mitral. And I would assess the rate and rhythm for 1 full minute with the diaphragm also, so it could be heard easier. Okay, I'm going to go ahead and get you to lay back for me now. And I'm going to be assessing for any heaves or lifts, none noted. I'm going to palpate over all those areas I just auscultated for any thrills, none noted. I'm going to be repeating my oscillation with the bell. Aortic, pulmonic, Erb's, tricuspid, and mitral. Everything sounds good as 1S2 and regular rate and rhythm. I am going to now go ahead and assess for any JVD on both sides. Everything looks good, no JVD noted, and then I'm going to go ahead and go on to the abdominal assessment. I'm going to be looking at the abdomen for color, temperature, moisture, texture, edema, any bruising, scars, lesions, or nevi. Checking the turgor also. And then I'm going to be looking at the abdomen for its contour and symmetry, which it looks like it's symmetrical and flat. I am going to then be listening to the the arteries in the abdomen, starting with the aorta, going on to the renal. I'm assessing for any bruits, going on to the iliac, and going on to the femoral. No bruits noted. I'm going to be then listening for bowel sounds. Okay, normal active in all quadrants. I'm going to then be percussing the abdomen. Okay, tympany noted in all quadrants. And then I'm going to be palpating the abdomen. Do you have any tenderness?
No.
Okay, no masses noted. He's not guarding whenever I'm palpating the abdomen. I'm going to be assessing the liver now. No enlargement noted. Do you have any tenderness there?
No.
I'm going to be assessing the spleen. No enlargement noted. Any tenderness over there?
No.
Okay, very good. Go ahead and sit up for me. I am going to check for CVA tenderness. Any tenderness?
No.
Okay, good. Next, I'm going to go ahead and move on to the musculoskeletal assessment. I'm going to be looking at your hands first. Looking at for any redness, any nodules, tenderness, do you have any tenderness in any of your hands?
No.
Okay. I'm looking for any swelling, any crepitus, any deformities, none noted. And then I'm going to be going ahead and assessing your radial pulse +2. I'm looking at your capillary refill. It is less than 3 seconds. I'm looking for any warmth. I am looking for any skin, all your skin is intact and everything, and no swelling or anything noted. Then I'm going to be having you go ahead and squeeze my fingers for me. Okay, strength is 5 out of 5. I'm going to be checking your hand range of motion, so go ahead and flex your fingers down, extend out, hyperextend. You're going to abduct them away, adduct back together, get your thumb, go ahead and put it at the base of your pinky. Okay, good flexion. Then I'm going to have you do finger thumb opposition. Very good. Be looking at your wrist for any redness, any swelling, any deformities, any nodules, crepitus, any tenderness in your wrist.
No.
Okay, good. I'm going to go ahead and get you to flex down, extend up, hyperextend for me. You're going to radially deviate, ulnar deviation, and rotate for me. Okay, very good. Next, I'm going to go onto your elbows, and I'm going to be looking at your elbows for any nodules, any tenderness, any redness, any making sure they're both symmetric. No crepitus noted. I'm going to go ahead and do you have any tenderness in either area?
No.
Okay. Have you flex up, extend down, hyperextend them out. Okay, very good. And then I'm gonna have you pull back for me, testing your bicep strength, push down, tricep strength. Same over here, pull up, push down. Okay, strength is 5 out of 5 for both areas. And then I'm going to go ahead and have you look at your shoulders. I'm looking at your shoulders for any redness, any swelling, any deformities, any nodules, crepitus, tenderness. Do you have any tenderness in either one of your shoulders? Very good. We're going to go ahead and do your range of motion. Flex up, extend down, hyperextend back. You're going to internally rotate both sides. Very good. And you're going to externally rotate up like this. You're going to abduct away, adduct in. Very good. And you're going to circumduct.
Oops.
I'm sorry. And then all of the range of motion looks good for that area. I'm going to go ahead and have you, for your shoulders, I'm going to go ahead and test your strength for that. So you're going to abduct out, press my hands up, and pull them back in. Okay, very good. Strength 5 out of 5 in both areas. And next I am going to go ahead and have you close your eyes for me. Tell me where the sensation is felt.
Left arm,
What about this one?
right forearm.
Okay, very good. And I am going to check your vibratory sensation. Go ahead over your proximal ulnar prominence. You feel that?
Yes.
What about over there?
Yes.
Very good. Next, I'm going to go ahead and check your reflexes. So I'm going to check your brachioradialis. Okay. Biceps. Okay. I'm going to go ahead and have you do this. Check your tricep reflex. Relax your arm for me. Okay. Brachioradialis. Biceps. Triceps. Okay, very good. And check your patellar reflex. Okay. Okay. And check your Achilles reflex. Okay. And I'm going to check for Babinski reflex for your toes to curl down. Okay, I'm sorry. Okay, very ticklish. No Babinski noted. And then I'm going to go ahead and check for your stereognosis. Get you to close your eyes for me. Tell me what's in your hand.
Coin.
Okay. What's in this hand over here?
Cotton.
Okay, very good. And then I'm going to check for your graphesthesia. So keep your eyes closed for me. What am I drawing in your hand? Shape.
Circle.
Okay, what about this one?
Triangle.
Okay, very good. And then I am going to, both those tests were normal. Then I'm going to go ahead and check for your cerebellar function. So what I'm going to have you do is we're going to first do finger-thumb opposition. Very good. And then next we're going to do hand flops. So we're just going to go as fast as you can. Okay, very good. And then next we're going to, I'm going to have you put your finger right here on your nose and you're going to touch my finger, okay? Okay, back to your nose. Other side. Okay, very good. So cerebellar function seems normal. And so we're going to go ahead and assess your lower extremities now. So I'm going to be looking at both of your lower extremities for color, temperature, moisture. I'm going to be looking for any redness, tenderness, any deformities, any nodules, any crepitus. Do you have any tenderness in your lower extremities?
No.
I'm going to be assessing for any warmth, any edema, any skin lesions or anything. Nothing's noted. I'm going to first go onto your toes. I'm going to be looking at any of them, specifically for any redness or nodules. I'm going to get you to flex your toes down for me. Go ahead and extend them back out. Go ahead and extend them up for me. Hyperextend. We're going to abduct them away. We're going to adduct them back. Okay, very good. All of the range of motion intact for that. I'm going to go onto your ankles now. So I'm going to get you to, I'm looking at your ankles for any redness, tenderness, any warmth, any swelling, any symmetry, any nodules, crepitus, everything looks good. I'm going to get you to dorsiflex your feet up for me. Plantar flex them down. I'm going to get you to invert them for me, opening them up, and then I'm going to get you to do eversion for me. Then I'm going to get you to circumduct your ankles, rotating them around. Very good. And range of motion is intact for both of those. Next, I'm going to go ahead and look at your knees. I'm looking at your knees for any redness, swelling, any deformities, any tenderness, crepitus, nodules. None noted. I'm going to get you, I'm testing your strength first, so I'm going to get you to go ahead and push out for me with your knees. I'm going to get you to straighten one out for me, pull back for me. Very good. This side. Okay, very good. 5 out of 5, both sides. I'm going to get you to abduct away from me, okay? Adduct into my hands, very good. Strength 5 out of 5 on that. And then I'm going to go ahead and test for your sensation of your lower extremities. So I am going to get you to close your eyes. You tell me where this is felt.
Left leg,
Okay,
right leg.
all right. Felt equally on both sides? Has it felt equally?
Yes, it did.
Okay, very good. I'm going to go ahead and test for your vibratory sensation of your medium malleus. Do you feel that? What about over here?
Yes. Feel
Very good. Okay. Next, I am going to get you to go ahead and stand up for me. And then we are going to test the range of motion of your hips. So I'm going to get you to flex your hip outward like this. Okay, extend it backwards. Hyperextend. Okay, we're going to internally rotate, externally rotate. We're going to abduct away from us, adduct back to us. Okay, very good. Other side. We're going to flex, extend, hyperextend. We are going to internally rotate, externally rotate, abduct away, adduct in. Very good. Okay, range of motion is intact for that. We're going to go ahead and do your knees. We are going to get you to flex your knee, extend it out, hyperextend, yes, flex, extend, hyperextend. I'm sorry. Range of motion is intact for that. I'm going to go ahead and look at your spine. I'm looking for any deformities here, none noted. I'm going to get you to flex your spine forward for me. Okay, no scoliosis noted. Extend backwards for me. Hyperextend for me. We're going to laterally rotate to the side. Other side. Go ahead and twist, rotate for me. Very good. Range of motion is intact for your back. And no swelling, nodules, crepitus, tenderness, anything noted there. Next, I'm going to go ahead and get you to put your feet together for me. We're going to do the Romberg test. Go ahead and close your eyes. No swaying noted. So that's a negative Romberg sign. Very good. And then lastly, we're going to go ahead and do our walk. So walk forward for me. Turn around and walk back for me. Okay, turn back around. Gonna heel toe for me. Very good. Back to me. Okay, gait is steady and equal. And next we're gonna hop on one foot. Okay, other foot. All right, very good. Balance is good with both of those, and that concludes our assessment.